All right, Cesar, please welcome everybody in.
All right, great. Thank you, Tamara. Well, greetings to everyone. Saludos, compañeros y compañeras. This is Sunday, February the 7th, and actually we're going to be talking about very important discussions. This is the importance of U.S., Canada, and the Cuban and medical and scientific collaboration to treat and prevent COVID-19. My name is Cesar Omar Sanches. I'm actually a member of the New York, New Jersey Cuba Coalition. My co-chair for the program today is Tamara Hansen. She's an executive member of the Canadian Network on Cuba, coordinator of the Vancouver Communities in Solidarity with Cuba, and author of The 5 Decades of the Cuban Revolutions, The Challenges of an Unwavering Leadership.
Good afternoon, everybody. So wonderful to see all your faces at this Saving Lives webinar and meeting. I want to acknowledge that as a chairperson in Vancouver, Canada, I'm on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I know many of us are calling from across Canada and the United States. And if you are also residing on Indigenous territories, I hope you will take a moment to reflect on the responsibility we have to Indigenous nations to recognize, respect, and support their historic and inalienable rights. Today, we're here for the Saving Lives campaign, which is a campaign organized by the U.S.-Cuba Normalization Conference Committee. And this campaign has been going on basically since this pandemic began. And it's a campaign to encourage U.S.-Cuba and Cuba-Canada collaboration, especially medical collaboration in the face of this global COVID-19 pandemic. We believe that there's a lot that people in Canada and the US can learn from the achievements of Cuba during this pandemic. And we believe that we need further normalization of relations in order to make these collaborations between the US and Cuba possible, and as well as political pressure in Canada for further collaboration. Why do we think that this is important? Let me just highlight a couple of statistics. Cuba and LA County in California are similar in population. As of yesterday, February 6, 2021, Cuba has had 233 deaths, while LA County has had 17,955 deaths. That's 77 times as many deaths, almost 80 times as many deaths in LA County, California. When we look at Canada, the province of Ontario has had 6,435 people die during this pandemic. And again, the province of Ontario has a similar size population as Cuba. This means that 460 people per 1 million people in Ontario have died, compared to only 21 per 1 million people in Cuba. So when we look at these statistics and we are fair, we have to understand that Cuba has made some amazing achievements in the fight against COVID-19, and that we want to highlight this for people in Canada and the US and explore the possibility of further collaboration between our countries. We're honored to have you all with us today at this meeting, and I'm going to hand it back to Cesar for a preview of the program.
Thank you, Tamara. The program, we have an excellent program that we all, the Saving Lives campaign, along with all the solidarity group that put together. And I'm just going to go over very quickly. We're going to be actually showing excerpts of the documentary of Cuba and COVID-19 Public Health and Science and Solidarity. We have special guest speakers by Dr. Vela, Alyssa Jones Garner, and Judy Sheridan Gonzalez. Speaking from the Saving Lives campaign, we have compañeras and Sister Rita Barak, I hope I'm pronounced it correctly, David Paul, and Marcy Shapiro. And of course, right towards the end of the webinar, Zoom meeting, we'll be wrapping it up. We'll have breakout sessions about how we can strengthen our campaign with the US and Cuba, Canada medical collaborations in the face of the COVID-19 pandemic. And I think Tamara, towards the end, she will actually give you more of a breakdown exactly the process. Right now, we're going to start off with Helen Yaffe's video, and but just to give you more of a detail, it's a 20-minute of a 1-hour documentary. Cuba and COVID-19 Public Health, Science, and Solidarity. It's researched and presented by Dr. Helen Yaffe and Dr. Valia Rodriguez. Both decided to make this documentary available for free on the public on YouTube. We hope that after the webinar, you take the time to see the documentary. Please, brothers and sisters, if you can share it throughout all your social media, that's very important. We need to get this message out. And of course, the YouTube will be actually posted on the chat and on Facebook. So if you look towards your right-hand side, you will see the link to the video itself. Okay, so if we're ready, we could actually start the video.
All right, yes, let's go to, it's a first 11 minutes of the document, some clips of the documentary.
Nosotros tenemos una amiga que muy querida por nosotros, que vive en España, y el día 13 de marzo ella llegó a Cuba y a los 2-3 días comenzó a sentirse malestares propios de la enfermedad, acudió al médico, la ingresaron, por supuesto, le diagnosticaron el COVID y nosotros entonces tuvimos que también ingresar para que se nos estudiara, a ver la posibilidad que había de que también nos hubiéramos contagiado y así fue. Quedamos contagiados en ese entonces.
La especialista de epidemiología del municipio nos comentó que nuestra amiga había sido positiva. Ellos vinieron en una ambulancia, nos recogieron aquí en la casa y nos trasladaron hacia el hospital. O sea, hay un sistema de la salud pública que cuando hay alguien contagiado se recoge en su casa o posible contagio y se traslada hasta el hospital que se...
De allí no podíamos movernos, no nos iban a dejar salir del hospital. Sucediera lo que sucediera. Estábamos bajo un régimen de aislamiento y de tratamiento que es inviolable y no íbamos a poder salir de allí.
Realmente fue muy triste porque estábamos, imagínate, encerrados también. Después ya nos separaron. Mi papá se fue a terapia, estuvo en terapia intensiva casi más de 10 días, entubado, entonces, y crítico además, un riesgo de muerte. Entonces, para nosotros fue realmente una experiencia súper fuerte. Yo creo que es una de las experiencias más fuertes que yo he vivido en toda mi vida.
En Cuba nosotros no competimos entre las instituciones, al contrario, colaboramos, nos potenciamos, nos apoyamos mutuamente. Esa es una característica de la ciencia en Cuba. Es un país con muy limitados recursos, no nos podemos dar el lujo de competir. Pero además la naturaleza propia del sistema socialista cubano y de la salud pública cubana, que es universal y gratuita para toda la población. Son instituciones que pertenecen al gobierno, al Estado, y nuestro fundamental objetivo es resolver los problemas de la sociedad. Es decir, no lucramos con los productos que desarrollamos y por lo tanto no tenemos este conflicto.
A mí nadie me preguntó cuando entré en terapia intensiva si yo era de izquierda, de derecha, ateo o católico, nada. Nadie me pidió una tarjeta de crédito, nadie me dijo cuánto me costaba la cuenta, nadie me dijo si tenía un seguro médico y me atendieron como si yo hubiera sido el paciente más importante del mundo. Así atendían a todo el mundo.
This idea of complementing each other was since the beginning of the Cuban virus. And this is the same what is happening now with the vaccine. I mean, it's not something new. It's a kind of a way of thinking, of behavior.
Cuba era un país con un 40% de analfabetismo cuando triunfó la revolución. Un país donde la ciencia eran iniciativas aisladas, no había instituciones científicas como tal, y desde un inicio Bueno, la mayoría de la población no tenía acceso a la salud pública y desde un inicio la revolución priorizó la salud pública y la educación como un programa a largo plazo, un programa estratégico a largo plazo. Primero, alfabetizar a la población. Después, alcanzar diferentes grados de escolaridad. Después, que todo el mundo tuviera acceso a la universidad, todo gratuito. Y ya cuando se logró tener una masa de personal universitario instruido, pues entonces la prioridad fue el desarrollo de la ciencia y se comenzó a invertir en el desarrollo de la ciencia. Mucho se debe a la visión de un hombre, de Fidel Castro, su humanismo y su preocupación por el desarrollo social desde los inicios mismos de la revolución, y esto se programó estructurado para un país con limitados recursos como Cuba.
The whole development of science and this biotechnological center has received a personal attention from Fidel. He visited all these centers. He would discuss with the scientists, and this was a message to the rest of the government. This is what is important. The future of the country has to take into account the development of science, of knowledge, of technology, and this is very important.
Es muy significativo a partir de los años 90, cuando ocurrió la debacle del sistema socialista en Europa del Este y Cuba se introdujo en una profunda crisis económica por la caída de las exportaciones en un 35%, etc. En situación en que en cualquier país del mundo lo primero que se recorta son los presupuestos de investigación, de educación y de salud, en Cuba la prioridad fue la ciencia y desarrollar nuevos centros de investigación. En ese periodo se inauguraron nuevos centros de investigación y se dedicó recursos sustanciales a la investigación científica. Y eso ha sido una estrategia a lo largo de todo el periodo de la revolución que se ha cumplido y que permite mostrar los resultados que hoy mostramos.
Since we can say something like 81 have been using the very close collaboration of different entities, including scientists, in the struggle against the pandemic.
The fact that it's a centralized health system, which is free for everyone, universal coverage, allows an efficient deployment of whatever resources we have. We could do better if we had more cash to buy more materials. But the fact that we have a national industry that allows us to produce most of the medicines that are used for treating pandemics or epidemics or any kind of diseases, that we have a national production of different kinds of medical equipment. For example, for immunological tests, to see if antigens are related to any disease or the antibodies are circulating in the body, every municipal has a lab. So as soon as they set up a test and they start manufacturing the regions to do the testing, it's immediately distributed all over the country. So of course, it would be much easier if we didn't have such a difficult economic situation and if we didn't have this continuous persecution by the U.S.
There's no doubt that the United States increased its hostility towards Cuba during the pandemic time. Basically, they enforced 43 additional measures to the 200 blockade measures that were taken during Trump period. So we are talking that in the first semester of 2020, right, there have been 43 actions specifically designed to upgrade the siege against Cuba. I think that the United States government philosophy has been to take the COVID-19 as an opportunity to enforce and upgrade the embargo or the blockade against Cuba. They've made an assessment that the combined effect or impact of the US blockade reinforced for the last 4 years, together with the crisis that a country will experiment at dealing with the COVID-19, will make Cuba more vulnerable in terms of its capacity to react to such a challenge.
El bloqueo nos ha afectado muy significativamente en el intercambio científico, en el acceso a recursos. Cuba está bloqueada financieramente en el sistema financiero internacional, en el acceso a tecnología, a la compra de equipos, sobre todo equipos de alta tecnología que se producen muchos de ellos exclusivamente en Estados Unidos y está legalmente prohibido venderlos a Cuba, en el mantenimiento de los equipos, en el suministro de piezas de repuesto para los equipos, en la compra de reactivos, muchos de los cuales, o la calidad de los mismos es de empresas norteamericanas. Hay que comprarlos a través de terceros países, evadiendo el bloqueo. Realmente es muy complejo y implica costos muy altos este bloqueo, y realmente eso nos afecta muy significativamente.
It is true, as you know, that it harmed Cubans badly in terms of hardship, of the long lines that you see on the street, of days that we had a blackout, of days that a vessel could not touch Cuba, or touch Cuba but could not deliver their cargo, because at that time a phone call from Washington was made to Lloyd's or to any insurance company in the world saying, hey, if this vessel named Claudia leave their cargo in Cuba, we will punish you, or we will take away, or we will put a fine on you according to their illegal biggest system of sanctions and unilateral coercive measure that exists in the world. The most apprehensive, the most enforced for the longest period of time.
All right, so yes, I see some applauses, some silent applauses there for really just a few excerpts from this fantastic documentary from Helen Yaffe and Dr. Vela. Again, we are going to come back for another 6-minute clip that highlights Cuba's work internationally later in the meeting, but that was really to highlight basically how Cuba is treating its COVID-19 patients, to look at some of the medical advancements that Cuba has been able to make, and also the challenges that Cuba is facing due to the blockade. So we hope you enjoyed that. Again, the whole documentary is an hour. It is available on YouTube, and we highly encourage you all to go and check that out, share it on your social media. Because today is organized as a meeting rather than a webinar, you may have speaker view on, or you may have gallery view on. If you are seeing about 25 people on your screen and it's getting a little bit distracting, you can go up to the top right corner of your Zoom where it says view and switch it to speaker view, and that will highlight whoever is speaking larger on the screen for you. Rather than having the gallery view where you've got about 25 little people on your screen. So I was just asked to remind people of that, and also that we are not live streaming today's meeting on Facebook, as we can only stream webinars, but we are recording today's meeting, and we are planning to post that in order for people to learn more about the Saving Lives campaign in the coming weeks. I'd now like to introduce Cesar Sanches. He is a community activist. He's my co-host today on the webinar, but he's also a guest speaker. He lives in New York, and he is a survivor of COVID-19. He's also the web designer for the US-Cuba Normalization Coalition. So we're happy that Cesar is co-hosting with me today, but also that he's going to share a little bit about his journey with COVID-19 living in New York. Welcome, Cesar. Cesar, you got to make sure to unmute.
Hello? Yes. All right. I hope
Perfect.
everybody.
Gotcha.
Well, I apologize for that technical delays. I'm sorry about that, guys. Well, my COVID experience, I mean, I could go on for hours, but I'm going to keep it very short. It's pretty much no different than a lot of COVID-19 survivors and people who still have COVID is going through these very difficult times and of course the after effect of COVID. Last year, November 6th, I actually contracted the virus, and which kind of led me in the hospital for over 2 weeks. And I could say this, ladies and gentlemen, brothers and sisters, this is something that it's like I thought I would have never experienced, and I experienced it firsthand. The shortness of breath, the migraine headaches. It's like you really feel like you have like an anvil pressed against your chest. It's very hard to breathe. The dizziness. And then while I was in the hospitals and I was actually on a oxygen, I guess you could say respirator, not the actual ventilators, what the New York City actually has been imposing and putting on many of the COVID-19 patients. But it took me almost close to about a week until I started seeing better results and my breathing kind of got much better. But one thing that I noticed too with my COVID was like the excessive hair loss. And I guess that's one of the reasons why you see me with this hat on. Otherwise you would have this bald figure, bald right in front of you speaking to you as we speak. But all jokes aside, this is something that it's so painful. It really is. And one of the reasons why I working with the Saving Lives campaign, because based on my experience and what I saw in the hospital firsthand, and other COVID-19 experience, and some of them weren't so lucky. Some were discharged, and then people that I met across with COVID-19 and their experience, they have the same problem because just because you don't no longer have COVID, you still have kind of like these health conditions and physical aftermath. And I still have shortness of breath from time to time, migraines from time to time. I have to probably take a couple of Poppins and Advils just to cut down the pain so I could actually focus. Doctor at the time, the consultant doctor actually said that my hair will actually grow back eventually. It could be 3 to 6 months, maybe a year. And now with the second variants that I keep on hearing about COVID, I mean, we don't know exactly. That's why the Saving Lives campaign, why I'm actually working, this is something that we need to focus on. This is something we need to really keep on pushing for medical staff from Cuba. We need to work with Cuba because I believe strongly that if we don't have some sort of collaborations internationally, more people will unfortunately will die, will suffer more family members will have to see their loved ones actually go through this horrendous moment that we're all experiencing. Well, saying that, I say that I encourage my brothers and sisters watching this right now, please, the question is that how do we work together with Cuba? How do we, we bring together, how do we bring in, how can we be more informative? Social media is fine, but I think that we have to do a little bit more than that. Write to your congressman, get involved, do what you have to do, but we need to have this resolved. We need to have some sort of stability, a better plan. But that's it for now, for my story. But we have to continue with the program. And right now, I want to introduce to Dr. Vela, who is actually the graduate of Latin America Medical School in Havana, now working as a doctor in Los Angeles. So Dr. Vela, mic is all yours. Are we good there?
There we go. Hi. Hey, Cesar, thanks for sharing your story. And man, it's so good, to have you here. You had a positive outcome. I'm Abraham. I am a graduate at Latin American School of Medicine. I graduated in 2016 and was able to transition back to the U.S. and started a family medicine residency program at Pomona Valley here in LA County. It's been a whole life-changing experience. What we're experiencing right now with COVID really is something that hopefully we all don't get to see again later in this lifetime. Hopefully we never do. And I just want to talk briefly about what crisis does to people, to countries. You know, when a crisis hits a country, that's really where you could determine what type of human beings run your country. Whether humanity is the first interest, or if it's the last, or if profits are the first interest and humanity and lives are the last. Unfortunately, we live in a very in a country that's amazing, that's great, but it is a very toxic system. And talking specifically about the healthcare system here in the United States, we have been able to see it took the mask out of this American dream, right? And a lot of people now live an American nightmare. When you put money in, there is no value for human life. There isn't, and I think we're all clear with that. And when you put money first, you're gonna have a lot of deaths. You're gonna have a lot of deaths, and you're gonna have a lot of people in government that don't do anything because they're still making a profits out of all of our lives. The way our healthcare system is set up here in the United States, we're not patients, we're not people, we're clients. We're clients that profit out of your symptoms, that profit out of your lives, literally, and that's not okay. That's a crime. When I started med school in Cuba at ELAM, our first medical school class, told our medical teacher said, "This is the first lesson I learned, my first day in class, really just soaking everything in." And they told us, "We want you to practice medicine with a biopsychosocial and spiritual perspective. If you see medicine under that lens, you will be able to treat a lot more humans. You will be able to treat a lot more people in a humane way. When you focus in how much money you can make out of a certain symptom or a certain patient, you will have detrimental effects. You will have people dying of preventable diseases, which still happens in the United States, whether you believe it or not. We still have people that are not vaccinated. We have kids that are not vaccinated. Our maternity child mortality rate is higher than it is in Cuba. When you compare the healthcare systems in the world, the US is like in 37. Is that reasonable for the country that spends the most on healthcare, yet you have one of the worst healthcare systems in the world? To me, that doesn't make sense. You know, and as US citizens trained in a country like Cuba, all the, for a lack of a better word, all the crap we get for doing that and coming back and really trying to practice the way we were trained, it's difficult. We come back and reinsert ourselves in a like I mentioned, a toxic healthcare system where we are forced to practice the way the whole medical systems. And if we try to deviate from that, what happens? You won't get a job. You're called a communist. You're called a socialist. You're called unknowledgeable physician, and it's really a battle uphill every day. Every day is a battle uphill. I've had mixed messages every time. Patients always ask me, "Where'd you go to med school?" And of course, proudly I tell them where I went to med school, and a lot of them react positively. They said, "We need a different approach. We need different doctors here. We need a different mentality to health." And then you got the other ones that start feeling uncomfortable. "Oh, does this doctor know what he's doing? Can I get another physician? Can I get a U.S. physician?" And it's this, everything is, you know, controlled by the media. The way the United States has portrayed Cuba to its citizens, it's sad, you know. And I experienced that when I left to Cuba. The things people would tell me, that I would be told that I was going to starve, that they were going to steal my shoes, that I wasn't going to have a phone. The things that was a militarized country, that I wasn't going to be able to walk around safely. And honestly, it was, I'm sure a lot of you have been to Cuba and you know that what a myth that is, right? To be able to go to a country where education is a human right, where shelter is a human right, where healthcare is a human right, medications, employment. You don't see homelessness in Havana, which is a huge capital, not only just in Cuba, but in the entire world, you don't see homelessness. And to me, coming back home and traveling back and forth is just astonishing the way a country with such low resources, when I say resources, I mean monetary resources, because Cuba has the human capital, they have the human resources, they have the heart and the humanism, and that's the way Cuba survives, right? But when you talk about things like the blockade and all the sanctions that the US imposes on Cuba, that's a genocidal blockade. And if you think about it, it's the longest genocide that there's been in the history, and it continues to go. And when the COVID pandemic hit, the pandemic is choking every country, the US the most. Then you increase the sanctions, that's increasing your grip on Cuba's neck. How are they still able to have better numbers statistically than LA County, for example? Someone, I think Tamara, you were going over the numbers and the deaths in LA County. Being a physician in LA County, this time has sucked, has really sucked. I am actually still, I'm a third-year resident now, so I'm still in training. So it sucks a little more because we are used however the system wants to use us. We have seen many deaths at the hospital on a daily basis. The fact that family members cannot come in and see their loved ones, and having to communicate them that they have passed or that they're not doing well, it is devastating for any physician's mental health, for any physician's physical health. And they're willing to keep going knowing that we're working for a system that's not working for us. It's really depressing, right? At my residency program, the faculty have done a great job, like checking in with us, checking in with the physicians, trying to give people a break where they can, but it's been so difficult. It's really impossible to do. Right now, my fear is that we see numbers going down, and we've seen that in the past too, where COVID numbers were going down and we had another surge. Economy is what's driving the decisions that are being made during this pandemic. And what should be driving those decisions is human lives. And we have not put a dent in that yet, even though it seems like we are, but we're not. I want to contrast a little bit how COVID was managed in Cuba. I know we saw it in the video, and it really is. Having lived it, we had epidemics of dengue every year. And when we had the dengue epidemic coming up, what do? We canceled medical school, we canceled activities, and we went out to the streets and one by one, knocking at door by door, talking to each family member, assessing for symptoms, assessing for fever, assessing for stilled water so that mosquitoes can't grow every day for a month. And we will finish the dengue epidemic, just like that. If you had symptoms, you will be hospitalized so you wouldn't transmit it anymore. It is a real thing. We do that. Imagine if a physician came to your house random day and knocked in your house and said, "How are you doing? Anybody with fever here? Can I check your home to make sure there's no risk factors?" What would they do to me? Because I've suggested it here. I suggested that we do that here. And there's always, where are we going to get the money? Who's going to pay for that? It's a violation of privacy. And when we get that fight back from our own healthcare officials, it drains you, it fatigues you. So that's what Cuba is doing right now. You saw it in the video. They provided an ambulance for this family who had no symptoms at the time. They didn't have any symptoms yet. They were still taken to a scientific health care institution and were made sure that they were safe before they were discharged. You got to understand how the virus works. As physicians, we need to understand that if you don't isolate people, we're going to have 1.14 million cases. We're going to have close to 20,000 deaths compared to 229 in Havana, in Cuba. That's what's going to happen. The other side of it, that's more of the medical aspect, but when you think about why do people get sick in this country? I'm not talking about COVID. I'm talking about why do the African American population, why do Latinos and Latinas have more hypertension and diabetes? When you think about that, is the social determinants of health, is the social aspect of medicine. But no, you mentioned social medicine here. you know what happens. So when you think about that, we are social human beings. When you don't have access to homes, when you don't have access to food, you don't have access to safety, you don't have access to schools, or your schools are poor, or your schools are not safe, we are going to have more sick people. If we don't address those issues, nothing's going to change. Nothing at all. I guarantee you, nothing's going to change. And as physicians, we need to advocate for that aspect of medicine more. We need to ask our congressmen to make sure that there's affordable food, there's affordable, healthy food in our neighborhoods, that everybody has shelter, that we eliminate homelessness, that we treat drug addiction, we treat mental health. We need to advocate for that. Citizens need to advocate for that. I know it's difficult. Trust me, I know. And coming here, the most difficult transition I ever had was not going from the US to Cuba, it was coming back from Cuba to the US and realizing that our lives are not as important as the dollar signs. It was devastating. I had an experience where I needed medical treatment in Cuba. And the fact that no one asked you for your insurance card, no one asked you for, they just asked you for your name. That's it. I got eye surgery in both my eyes in Cuba and nothing of charge. You know, I come here and it's $30 copayment just to get my eyes checked. You know what you could buy with $30? You could feed a whole family for a week. And the way it's just, it doesn't work. And I think offering the citizens of the United States, offering government different options, the idea of collaborating with a country like Cuba should be something that should be accepted. Cuba has so many medications, so many scientific studies that can help people in the United States. Over 80,000 of people get an amputation of their foot because of diabetes. Cuba has a medication that can treat diabetic foot ulcers and prevent 73% of those. I just had a patient that I sent to a hospital for that. And not being able to provide him with what he needs, not being able to provide healthy food, insurance, enough needles for him for something so basic as diabetes is devastating to me. When I have to fight with specialists so they could see my patients that are undocumented or don't have insurance, that is devastating. That's a crime. These people should be in jail because you're refusing services for a human life. I could go on forever, but I want to end on a positive note. I want to thank you all. We are meeting in the day after Camilo Cienfuegos' birthday, a true revolutionary that continues to live in our spirits and in mine. I think I want to thank you all for what you're doing for Cuba, what you do for Cuba, the solidarity you show for Cuba is showing solidarity for the world, because what Cuba does to humanity is bring healing. It brings renovation. It brings new energy. It brings revolution. And by bringing that to humanity, I think we could all prosper towards a better world. I do want to mention one more thing before I finish. COVID, that's all in everybody's mind. That's all we're thinking about now. COVID is not just you're sick for 10 days and you're cured. It's not. And you could ask Cesar, he's probably still feeling fatigue. He's still probably feeling cough. We are now seeing something called post-COVID syndrome, where fatigue is the most common symptom that we see. I could just see how medicine is going to treat this syndrome going forward. If you go into your doctor and you tell them, I'm fatigued every month, here we go, antidepressant medications, here we go, this medication, go try that. Rather than if we prevent COVID or we prevent more people from getting COVID, we could prevent these long-term, they're calling them long haulers now. And it's just gonna keep devastating the healthcare system, it's gonna keep increasing unemployment, and we need to start making a change. You know, we need to start learning from countries that focus on prevention, that focus on human lives. So please continue to fight for all this. Please continue the work that you're doing. Really, it inspires me to know that there are people like you out there, and that there are people that care, and know that there are people in the medical field as well that we do try, and we're trying to take care of this. Thank you, everyone. If anybody has any questions, I don't know if we have time right now or later, please let me know.
Thank you so much, Dr. Vela. I hope everybody is giving you a silent, round of applause. If you open the chat, please do go back and read through. There's dozens of people who have left you messages there inspired by what you shared with us today. And we can hear both the heartbreak in your voice and the determination to continue forward. And we wish you all the best in a really challenging situation. So thank you so much for sharing all of that with us today. I now want to invite to the virtual microphone Alyssa Jones Garner. She is an SEIU Local 1021 member and leader, a shop steward, political organizer, and community activist from San Francisco. We're very honored to have her here with us today, and that she is going to be speaking a little bit as well about why we need this Saving Lives campaign. Welcome, Alyssa.
Thank you, Tamara, for that beautiful introduction. I'd first like to acknowledge that I come to you from Ramaytush land, also known as San Francisco. And I'd like to thank you for allowing me to speak today. The US's response to COVID-19 has revealed centuries of inequities, inequality, and this push for profit over people. And it all began with a lie from our former president, Donald Trump, downplaying the severity of this virus. It sent a ripple effect through the healthcare administration here. I can speak for my experience in San Francisco as a healthcare worker being told, oh no, don't wear a mask around our clients because they'll become scared and they won't want to come in and receive services. And I was completely floored by that in the midst of what we now know as a severe pandemic that has circumnavigated the globe. To be told not to protect myself and our clients who are pregnant Black women, it was horrendous. But in a society that puts profit before lives, that's a normal course. That's the standard of the day. And as we went through this pandemic, we saw how a virus that attacks all without regard for color, for creed, or affluence had rapidly become a mark of poverty and minority status within the United States. Now, what I mean by that is the disproportionate effect that COVID had on communities of color, specifically Black and Brown communities. I myself contracted COVID-19 at work, and I am one of those long haulers who have no idea how long I will feel the effects of this disease. I know that it has taken an enormous toll on my family, on my friends, and the one positive is that it has reinvigorated me as an advocate for my community and for the patients that I serve. But getting back to the US's response, throughout every single step of the way, the US has decided to take this severely capitalistic approach to a healthcare matter, because healthcare here is an industry. It is a way to make money. It is a way to profit off of the pain and sickness and disease that affect us all by monetizing it. That's why you saw this push later in the year to develop vaccines rapidly and sometimes unsafely, with human lives being lost in the process and even their sacrifice being diminished as a matter of course. To this day, we are still seeing people die from the vaccines that are being made available currently, but those numbers are not being spoken to the public. They're not being made aware of it. They're being told, just keep going in, and it's putting our communities, our families at enormous risk. needlessly so. Cuba has developed drug treatments, vaccines, protocols that can help us if we would get out of our own way. One of the ways we can do that is by partnering with associations like Pastors for Peace, the Saving Lives campaign, building relations with Cuban labor, which I myself am a part of, and normalizing relations between US and Cuba. Cuba has so much more to offer us than just the groundbreaking way in which they see their citizens within the healthcare field. And that is the humanity in which they work. That is something that we have lost here in the United States. We have been reduced to numbers, to paychecks, instead of human beings who are suffering and in need of help and care. And it is incumbent upon all of us here today, we are advocates. It is incumbent upon all of us to take up that mantle and fight to end this embargo, because it is costing human lives every single day. And I'd like to speak a little bit about what Dr. Vela touched on earlier. Why are Black and Brown communities being disproportionately affected and impacted by COVID-19 in the US? And it's simply put that to be Black and Brown in this country is to be seen as less than. Before it was a popular thought, an assumption, a stereotype, it was codified in law that Black people were less human than our white counterparts. And once something is put into law and that ideology is reinforced, it becomes commonplace. It becomes a matter of fact instead of an opinion held by a racist few. It becomes a matter of fact to all. And that has made its way insidiously into our healthcare system. There have been instances of Black people suffering from COVID being turned away, not being believed when we describe the severity of our symptoms, being told, oh, you're just lying, you're drug seeking, which is a common phrase used. And as a result, Black and Brown people are dying at numbers surpassing our percentage of the population in this country. And that is unacceptable. It is inhumane, and it is a true crime against humanity to reduce someone's pain and suffering to a stereotype, a bias, and a statistic. In my work as a public health worker, I work primarily with Black women, pregnant Black women and babies. In San Francisco, 23% of all infant mortalities come from the African American community. In San Francisco, we are about 3% of the population here. I want you to think about that, what that means for my community. More of us are dying as infants than the total percentage of the population that we inhabit here. And our lives are seen as an acceptable loss. In Cuba, that is not the case. You are treated with a dignity and a respect that this country sorely lacks. But it has become standard procedure to do so here. So I would like all of you to take this message, take the humanity that Cuba has shown in sending doctors and nurses all over the world to offer assistance and aid, and ask of your elected officials, why are we holding back? Why are we attacking this nation that has done nothing but offer aid, offer humanity, offer respect to those in need, where we have failed? Because we have failed. And until we get our electeds to acknowledge that, to admit that truth, and move forward, we will continue this vicious cycle of sacrificing patients for profit until we take on this mantle that humanity needs to be restored to our healthcare field, that we need to make it a field and not an industry, that we need to see our patients as people and not consumers. We will continue to have this fight on our hands. And I, for one, will continue to fight for our patients, for my community, for all of you, because we are worthy. We deserve the right to fight for our lives, though we should not have to fight for basic humanity and dignity. I will.
Thank you, Alyssa. Thank you, Alyssa. I mean, you and Dr. Abraham Vela actually hit it. You know, a few things I actually mentioned is everything is profit mode. Even now, as we speak, you know, we have the Super Bowl that everybody's talking about, and yet, you know, and rather than trying to control, to curb and to control the COVID spread, is now the Super Bowl is now going to become, I guess it's fair to say, a super spreader, and that is unfortunate because it seems profit first, human lives come second, which is absurd. Thank you, Alyssa. And I just right now, I just want to introduce our next speaker. She is the emergency room nurse on the front lines of fighting COVID-19. She's also the president of the New York State Nurses Association. Please welcome Judy Sheridan Gonzalez. Judy.
Thank you, Cesar, and thanks to all these amazing speakers. I don't even know what I could add, but I was asked to talk about what happened during COVID. And I was thinking the title of my presentation would be The Abject Failures of the US Health System in Combating COVID-19. You know, as people have said, our for-profit healthcare system makes it impossible to really help people in the way we want to as providers and caregivers. Resources that are diverted to big pharma, to insurers, to for-profit hospitals, to all these so-called non-profit medical centers that function like for-profits, these big mega mergers of systems, health management organizations, IT consultants, marketers, business associates. What you find, if you look at the growth in the industry, it's almost 18% of the gross domestic product. That means nearly $4 trillion are spent on healthcare. And the per capita cost is nearly $12,000 per year, but because of the disparities, a lot more is spent on wealthy people and very little spent on poor people. And these health indices, as a result, are the worst in the developed world, which I think people in this audience probably know. Our morbidity and mortality rates are worsening, in fact, rather than improving. And that was before COVID. But if you look at the growth of healthcare jobs in the US, the caregiver jobs have, increased, particularly since Medicaid and Medicare were implemented in 1965. It's grown by about 150%. But administration has grown by nearly 3,200%. So the big growth in healthcare is, in the areas in which I discussed, not providers, not in direct care, but in the for-profit industry. So the U.S. is rich, but where does the wealth go? The wealth disparities in the U.S. rival medieval Europe, and when we want to know who accumulates it, I think we know it's certainly not the people who work for it. And it doesn't pay for goods and services for the population. And I think people, again, on this call probably know that that's all part of the neoliberal agenda: privatization, deregulation, anti-worker legislation, anti-community legislation, cultural manipulation, and the control of our minds through education and media and social norms. And these are the behaviors that are basically destroying our planet and our communities. And the disparities in our communities are definitely economic and racially based historically. Much worse today, not necessarily getting better. So how did that play out during COVID? We don't really have a public health system, so we had no preparation. There's no functional public health infrastructure. And we have seen this before. It's been very notable during disasters. In my union, a lot of us volunteer for disasters. We saw it in Hurricane Katrina in New Orleans. Superstorm Sandy, we found Wall Street was back up and running in 2 days, and our marginalized communities were still displaced. Some are still homeless with wildfires, with floods, and particularly after the 2 hurricanes, Irma and Maria, in Puerto Rico, over 5,000 Maria-related deaths compared to 10 in Cuba. And of course, as a direct colony, Puerto Rico suffers the most as it has no real governance, and there's a junta fiscal that basically governs the nation. But what happened in the US? In New York, and where we were at the epicenter, I work and live in the Bronx. We were the front line of COVID. We found out that they exported N95s and vents in January and February and made billions of dollars in profit instead of preparing for the pandemic here, in spite of the warnings of health professionals. With this austere neoliberal agenda and the cuts to Medicaid, closing of hospitals and beds, mostly in grossly underserved communities. In New York State, we lost 20,000 beds in 20 years. That's 1,000 beds a year. We had little space and little staff to care for people to begin with. And as was discussed earlier, these social determinants of health, who got COVID, people of color, the rate in African-American communities was 2 to 3 times much, Native Americans suffering even higher rates. Also the elderly, people with pre-existing conditions, very much among those people. Institutionalized people with mental illness in prisons and detention camps. I mean, this is what we saw. But what made it worse was the lying government that we had with this anti-science posture where the president and his crew says, oh, it's not really a big deal. It's not a big disease, with the Centers for Disease Control saying it wasn't airborne. And that led to thousands of frontline workers' death, not just health workers who died at large proportions, but also the poorest population, the delivery people, the people who worked in restaurants, delivering food. And in my own emergency room where I work, 80% of the people that I work with in my group, we developed COVID and COVID-like symptoms. 80% of the workers in the March and April period. So when we start off with the shortage of beds, shortage of trained professionals, with gross understaffing and overcrowding, particularly in the community in which I work and in working class communities and communities of color, we're already behind the 8 ball. Then being lied to and told that we didn't need PPE, we had to fight. We had to have rallies, and even in spite of social distancing and the things that we had to do, we had to have demonstrations and militant actions to just get N95 masks, to get equipment, to get training. People were living in their cars. Nurses were living in their cars so they wouldn't go home. The fear and the terror of bringing this disease home was really traumatic. Many deaths could have been prevented as caregivers in the earlier period. Were you supposed to flatten the curve? I mean, we had like a Mount Everest in New York. We started off with 1 patient. The next day there were 10. The third day there were 100. Within a week, there were 1,000 and more in my own hospital. It was so traumatic. The deaths were so large that rolling them out to these trailers, there was one unit that saw the back of the hospital where they were rolling them out. We had to put a canopy up because watching bodies go out and out and out was just, people couldn't even tolerate that. And you can't imagine what it's like to be a caregiver and knowing that you didn't have enough staff to save people and making a decision on whose life you would save and whose life you wouldn't save. This is the trauma that we had to go through because of what was going on in our country. And being terrified to bring the disease home. People started when we stayed at hotels, being the voice for the patient on FaceTime to say goodbye to families. We're still recovering from this trauma, and we're seeing it in the rise again. And so therefore thousands left the profession of nursing. We were already short, and people got sick, continue to be sick, as was discussed, and also, can't think of coming back to the same environment. And it's this mistrust of the government. The government failed us, the hospitals failed us, our regulatory agencies failed us. So it should be no surprise that how many people are afraid to take the vaccine. they're saying, oh, people don't want the vaccine. Well, what about hundreds of years of experimentation, particularly in communities of color, not trusting the government, knowing that big pharma has some control over here, and all the kind of fake news environment that people are in. There's a lack of trust in our government, very much different than in Cuba, where people, the trust of the government is really important. So in New York, just to give you some sense, we've had almost 36,000 deaths from COVID just in the state of New York. In February 3rd, there were 160 deaths. We've had 1.5 million positive cases, about 9,000 on February 4th. We have 8,000 hospitalized, but we have vaccinated first dose 1.5 million. There's been a big scandal now with the Attorney General of the state of New York pointing to understaffing resulting in nursing home deaths, and that is a constant as well. Many of us, myself included, are volunteering to deliver vaccines, and twice my shifts were canceled. And this is volunteering because they didn't have vaccine. Elderly have to have internet access to get the vaccine. These are the people being targeted, and if they don't have that kind of resource or family members who can help them, they can't get the vaccine. But the biggest tragedy is that people who've suffered as marginalized and this lack of trust has made it much worse in us trying to really stem it, because these are not anti-vaxxers. These are just people who are afraid of being harmed by the government's behavior in the past. So you have to think, where does Cuba enter into this conversation? I mean, we know that the normalization of relations are critical, and people have said scientific interchange is essential. You've heard of these instances of being able to share our science, but the social political interchange is really more important in my view. The structure and the goals, the organization of the Cuban health system can teach so much to mitigate illness here. We have to educate the public, promote community caregiving. And I want to, what this myth, when tragedy strikes here in this country, people do care, they volunteer, people donate money, they donate time, people in the United States are not as bad as the government. There's really a tendency for people to help one another. It's there. We just don't have an infrastructure for it. Even our nonprofit organizations like the Red Cross, they run like for-profits. There's nothing for people to do that. So building solidarity among the peoples of the US and the people of Cuba, that's an essential component of sharing the intellectual wealth of the nations. But we in the United States, we have to change our system. So it's one of social good, one system, remove insurance industry and the pharmaceuticals and all the predators that drive the costs up and drive the care down. We have to change our own system to one of humanitarianism and equity, both economic and racial, healing our people, our environment, and the traumas of hostility and divisiveness that is predominating. We had 75 million people vote for Trump. And I think everyone's aware of what happened on January 6th. So to share the truth about what happens in Cuba as opposed to the destructive warmongering rhetoric that dominates is critical, because our true enemies are the corporate power brokers that control our lives, not our neighboring countries, from Cuba to Venezuela to Ecuador to Chile, not those who migrate to our country and not those who stay in their own countries, and winning over the hearts and minds of our people to know that a better world is possible, and that building that world is a responsibility that belongs to all of us. So I want to thank you for holding this seminar. I hope that we can share what we've learned today with people who don't necessarily have access to this information. In that way, we can ensure that ending the blockade will be understood as not only a help to Cuban people, but a benefit to all society. Thank you.
Thank you so much, Judy, for sharing that with us. I mean, just really a traumatic experience, but so powerful because, we hear things, one day in the news and then they're out of the news the next day. And just that reminder of what this last year has really looked like is very powerful and reminds us of, that maybe New York's peak happened earlier, but it's happening in other places right now. And the duty that we have to continue this Saving Lives campaign. Thank you so much. So We had planned to show another 6 minutes of the Helen Yaffe documentary, specifically focusing on the amazing work of Cuba sending revolutionary internationalist doctors around the world. We are running a little behind schedule. Obviously, our speakers have been so powerful. We couldn't ask them to cut anything short, and really just wanted to let them share their messages today with us. But so we have to mention that, of course, Cuba has sent doctors and medical professionals to over 40 countries worldwide. There's especially a doctor who went to Italy who's highlighted in Helen Yaffe's documentary, which again is available for free on YouTube, and we really encourage you to go watch the whole thing. But we are just going to show kind of the last 2 minutes of the documentary where Dr. Helen Yaffe, again, university professor at Glasgow University, kind of summarizes some of the main findings of their documentary. And then we're going to come back for some reports from the Saving Lives campaign to highlight the work that the campaign has been doing and how we want to get more people involved. So I'm just going to ask that those speakers really try and keep their comments to under 4 minutes. And Cesar and I are going to get more strict so that we can go to our breakout sessions. All right, let's go now to this last kind of 2-minute clip from this important documentary.
By now, tens of thousands of people have died in Britain of COVID-19, and the country's gone back into lockdown. Cuba, meanwhile, is opening up to its new normal. Total deaths are less than 150, and to date, not a single healthcare worker, pregnant woman or child has died of COVID-19 on the island. Isn't that remarkable for a small Caribbean island subject to 60 years of sanctions? By reacting quickly and decisively, by mobilizing the public healthcare system and the state-owned biotech sector, the Cubans have kept contagion and fatalities down. They have also treated patients and saved lives overseas. Within 7 months, nearly 4,000 Cuban medical specialists had been to 39 countries to treat COVID-19 patients. Cuba spends a tiny proportion of what is spent in Britain and the United States on healthcare. But by planning its scarce resources, they are able to organise the kind of effective response we've seen during this pandemic. The key to Cuba's success has not just been the fact of state intervention, but the nature of that intervention. Cuba's socialist system is set up to prioritise welfare over private profit. Now, this may not be a lesson that most nations are ready to hear, but Cuba's international assistance during the pandemic at least shows the feasibility and the benefits of global cooperation to address global problems.
Thank you, Tamara. Thank you, Tamara, for sharing that very powerful word from Helen Yaffe. Well, we're going to continue with the program. Our next speaker will be Rita Baruch. I'm really hoping I'm pronouncing it correctly, Rita. She'll be presenting on the work of the Local Resolutions Committee on the Saving Lives campaign. And Rita, compañera, if you could just keep it on 4 minutes or less. Thank you, Rita.
Oops. Oh, thank you, Cesar. You got my name right. I'm coming to you from Richmond, California, which is also occupied Ohlone land. It's both moving and inspiring to follow such dedicated and spirited truth tellers. Thank you to all speakers. I'm a public health social worker of over 35 years. I worked in Detroit, San Francisco, and across Contra Costa County, primarily with maternal and child health in communities of color, and have certainly seen the challenges. I'm here to talk about what we can do and really take it from the positive side. I've been privileged to work with the Saving Lives Campaign Resolutions Committee for the past year. And I have a question for everyone. What do San Francisco, Berkeley, Pittsburgh, Pennsylvania, Cambridge, Massachusetts, and Seattle, Washington have in common? You can put your answer in the chat if you want. Well, the answer is
Resolution.
thank you. They have all passed resolutions requesting collaboration, medical and scientific, with health providers in Cuba. We, to date, there are 11 city councils and 5 labor councils that have passed it all over the country. When we passed a resolution here in Richmond, California, we were actually the first. And little did we know that it would grow and people would take this up across the country. And that has been quite inspiring. We simply went to the city council along with our council person, Eduardo Martinez, and the resolution was passed unanimously. Subsequently, we have developed sample resolutions, toolkits on how to do it, videos, all kinds of materials. And in every place that it's been attempted, it's been successful. Many times unanimously, but they've all passed. And we have currently in process resolutions that will be passed in places like New York City, Boston, and I believe Chicago's has just recently passed as well. So it's very exciting. Why are these resolutions so important? Well, as you can see, this is our concrete way of documenting and codifying the support that exists from electeds and labor officials all across the country for normalizing relations with Cuba. I cannot understate the importance of building these documented proof of this support. Our Cuban colleagues very much appreciate it and value it and want us to continue passing resolutions. So I'm going to read just 2 sentences from the one that just passed, San Francisco in January, Executive Committee of Labor Council. This is what we are asking for, and this is why we want everyone on this meeting today to think about doing a resolution in your area if you haven't already. Now, this is really important, I think. Be it resolved that we urge US Congress and President to lift restrictions on access to Cuban medical expertise to more effectively combat the COVID-19 pandemic by suspending travel sanctions against Cuba, cease ongoing measures deterring Cuba from importing medical equipment and medicines, and cease attempts to prevent other countries from accepting Cuban medical brigades. That says it. I wanted to read that because that tells you why we are doing this. That's what we want, and we will not accept anything less. And of course, that then leads us to normalization and an end to the embargo. If you haven't yet passed a resolution, please go to the chat where we have cleverly placed links for you to do. There's a little Google form, and you can indicate your interest on that. Very simple. There's also a link to a sample resolution. We are ready to support you in our committee with other resources, and we can help you do this. So please just let us know. Every resolution we pass strengthens our call for saving lives and normalizing relations. And I have to stop, but I just want to end by saying, show your love to Cuba, for Cuba, and the Cuban Revolution and the Cuban health professionals by passing a resolution. Thank you.
Thank you so much, Rita. And I would add, show love to, healthcare workers in Canada and the US and pass the resolution as well, because this is also about collaboration that will benefit our own healthcare systems. Thank you so much. We're now going to go to David Paul, who will be presenting on the work of the Medical Collaboration Committee. Again, Rita set a great example of staying on time. So David, we ask you to do the same. And Cesar will give you a little 1-minute sign there. David, go ahead.
Okay, hi, thanks for inviting me. I will try to stick to time.
make it some general comments and then some specific things that we're trying to do here in the Bay Area. I mean, it's obvious from what everyone said that control of a global pandemic requires medical cooperation, sharing knowledge and resources between countries and within countries. And COVID provides a unique opportunity to promote an interaction between Cuban and North American scientific and medical community who can be a natural and effective advocates for calling an end to the blockade and coordinating efforts around COVID and preparing for future and inevitable pandemics. We can take advantage of the medical community who regularly practice, in their regular practice, they share updates in research and experience with colleagues. And during this COVID time, they've been having many virtual discussions about how to deal with COVID. It makes sense to include Cubans in these conversations. Cubans who have had more success with COVID than the United States due to their biotech industry, but mostly to their public health system, which makes them ready to respond to a pandemic. They basically had improved Medicare for all for the last 60 years and showing how successful it is. The San Francisco Bay Area, we're trying to build on the mandate of the resolution in our city council calling for collaboration. And we're approaching clinicians, researchers, academics, and universities in the public health department, medical schools, medical student groups, to invite them to virtual dialogues with their counterparts in Cuba. We're also approaching unions that have a lot of health workers like the SEIU, National Nurses United, the California Nurses Association, and single payer groups who can all help in promoting these efforts. We are currently planning a specific webinar with Helen Yaffes and Valia Rodriguez, which is in her film, and with a discussion with the supervisors, members of the public health department, an ELAM student perhaps, and someone from the embassy. And building on that webinar, hopefully in April, we are approaching researchers and clinicians in public health in Stanford and the University of California, and to have a dialogue with their Cuban counterparts to share experiences around protocols, treatments, vaccines, later hoping to focus on more specific topics like diabetes and cancer, which Cuban has made great advances in. We've seen that there's a lot of reluctance in some in the medical community because they're so overwhelmed with dealing with COVID and the vaccine rollout that, and they have doubts that a small country like Cuba has much to offer. But this disastrous response in the US really shows that Cuba has a lot to offer. It's important to show people how Cuba prioritizes health as a human right, how they've shown their humanity for human health, international health brigades that have offered more help around the world than the Red Cross, UNICEF, and Doctors Without Borders combined. We have to show them and highlight the accomplishments and the expertise of the Cuban health system, and really highlight the most important is how cooperating with Cuba can solve problems here and benefit our own communities and the health and security of our own population by controlling COVID globally and giving access to innovative treatments that has been denied our population. These efforts will be different in different cities, and actually they don't need to necessarily depend on city council resolutions, although that's good to have that. We've been meeting with, in the medical subcommittee, with people from different regions of the country, trying to help support each other's efforts, and we encourage others to participate. We encourage you to utilize the resources in the Saving Lives webpage, the fact sheet on Cuban health accomplishments, the films, and other resources. And now Marcy is going to talk about their effort to actually achieve some medical cooperation and collaboration in Minnesota. Thank you.
Thank you, David. And of course, I'm so sorry to keep on rushing, but we are on a kind of a time restriction here. But thank you for that very insightful and powerful information. Our next speaker right now will be Marcy Shapiro. She will be presenting some important Cuban connections being made by the folks of Minnesota in collaboration with the Saving Lives campaign. Marcy, again, if you could keep it at 4 minutes tops, we would highly appreciate that. Thank you, Marcy. Marcy?
Okay, hi. I will try to keep it 4 minutes. so why am I even talking about this? And the reason is that in the Saving Lives campaign, we have been talking about collaboration and about how we can use the knowledge of the Cuban healthcare system to help in the United States and vice versa. And recently, it was on December 16th of 2020, we had the first kind of major forum with collaboration between the Cuban healthcare system and the University of Minnesota. And it was really an opportunity for us to see that it's possible to collaborate. And I'll just briefly talk about the forum and then talk about why this was so important. So the forum was basically a 2-hour webinar with people from Cuba. And there were 4 experts from Cuba and 4 from the university from Minnesota. About 30 people attended the webinar, and it was mostly healthcare people, both from the University of Minnesota and other area universities. I had the opportunity to be in the audience, so it was a really good chance to learn about both the Cuban system and what we're doing in Minnesota. So it was basically high level leaders at this particular forum. I really want to say that it doesn't have to be the model that we have, that it can be for a forum with grassroots healthcare professionals, it can be with elected officials, it can be a mix. So this particular one was really academic and high level officials. And they talked about public health, vaccines, clinical therapies. So some examples of people from Minnesota were the dean of the medical school, Michael Osterholm, who's a well-known expert on COVID and part of Biden's transition team on COVID, and Dr. Francisco Duran, who's the director of epidemiology in the Cuban Ministry of Health, kind of the Dr. Fauci of Cuba, the director of science and technology innovation in Cuba, in the Cuban health system, and people from research institutes in Cuba. So it was, two important people who spoke at it also were the president of the University of Minnesota and one of our senators, Amy Klobuchar, who's an advocate for ending the embargo in Cuba. And I wanted to just say a couple things about why this was so important. First of all, it showed that it's possible to collaborate. The technology was probably the hardest part. And it helped that we had a state resolution introduced in the Minnesota State Legislature, right, kind of in conjunction with the same time. And so our governor basically encouraged the medical school to be collaborating with Cuba. The senator who sponsored it met with Dr. Osterholm to encourage him to participate in this. This forum was organized by the University of Minnesota School of Public Health, the nursing department, and MEDIC, which is a nonprofit group that works in Cuba in the Cuban healthcare with Cuban healthcare workers, and also publishes a journal in the US on Cuban medical care. And John Oswald, who's one of the key organizers, is actually on this Zoom meeting. Okay, so I just want to say this is important because it shows that you can normalize discussion between Cuban healthcare workers and healthcare and with places in, excuse me, places in the United States, so like the University of Minnesota Medical School, and that it is a benefit to our healthcare system. I think there was some excellent presentations by Cuba on vaccines, on the description of the Cuban public health system. And I think it was really important for doctors in Minnesota to hear, doctors and other health workers in Minnesota to hear. And it helps decision makers kind of know that there's something to be learned from Cuba and its system. So we're looking forward to more collaborations in the future. Thank you.
Tamara? Okay. Well, thank you, Marcy.
Sorry about that, Cesar.
Oh, okay.
Okay. Yes, thanks so much to Marcy for that presentation. We've now just got a few announcements. We're going to explain the breakout groups and then we're going to get into it. We want to invite everybody to join the Saving Lives campaign. We are again, this whole webinar and today is about calling for further US, Cuba and Cuba-Canada medical collaboration to combat the COVID-19 pandemic. And if you want to get more involved in this campaign after the breakout sessions today, or if you're not able to stay with us and participate in the breakout sessions, we want to invite you to our next general meeting. It's going to be on Wednesday, February 17th at 8 p.m. Eastern Time. There's also a meeting of the Saving Lives Resolution Subcommittee on Monday, February 15th at 8 p.m. Eastern Time. And so we invite you to join these two, our main campaign meeting and also the subcommittee. If you're interested in getting involved, there will be an email sent to all participants about this from after today's meeting. I would also like to invite everybody to the Canadian Network on Cuba's monthly picket action against the US blockade. It is also happening on Wednesday, February 17th, just before the Saving Lives Committee meeting at 7 p.m. Eastern Time. And this is an international picket against the blockade. We're going to have speakers from Argentina, Puerto Rico, as well as Glasgow and across Canada and the US. So please come join us for an exciting and dynamic event against the US blockade on Cuba. All right, Cesar, your announcements.
Yes, we have further announcements on February the 25th webinar on changes to the Cuban economy. Join the U.S.-Cuba Normalizations Conference Committee for a special webinar on the changes to the Cuban economy. It's again on Thursday, February the 25th. We're having special featured guests from Cuba, as well as Dr. Helen Yaffe, as a documentary you just saw today. And of course, the registration will be posted on the chat, and on Facebook. So please take a look at that when you get a chance. Also, March 7th, webinar on women in Cuba. It will be, you join the U.S. Cuba Normalizations Conference Committee for a special webinar on Cuba's revolutionary women. On Sunday, March 7th, the registration will be posted on the chat on Facebook. And of course, I do have a letter there I'm going to read this if I can just find it, bear with me. Okay, unfortunately, I do not have that letter. I can't seem to find it. I do apologize for that. Okay, just bear with me. If not, sorry about that. No, I'm so sorry. I do apologize for that, for not having that letter from ACAR, but we will post it on the chat once I find it. Tamara, if you could just go on and talk about the breakout groups, please.
Sure. Just, I will just say quickly, there's a letter from ACERE or ACERE, Alliance for Cuba. It's been signed by Representative Bobby Rush, Representative Cohen, and Representative Gwen Moore. And they are looking for more representatives to sign on to this letter to Biden asking for normalization of relations with Cuba. They don't seem to have a website, but you can contact them via email to get more information about the campaign, and we will be posting their email in the chat. It is in the chat. Thank you, Allison. All right, so it is time for our breakout conversation. We were hoping to start this about 20 minutes ago, so we are going to be starting now, and it will be up to the different breakout groups to decide, you know, how long they want to go. We had envisioned this being about a 45-minute conversation on building the Saving Lives campaigns in different regions. So the breakout groups are going to be 1, New England, 2, New York, New Jersey, and Philadelphia, 3, Southeast from Maryland down to Texas, 4th, Midwest, including Western Pennsylvania, 5, California, 6, Pacific Northwest and Rocky Mountains, and 7, Canada, Quebec, and international. So we, our technical host here, Allison, as well as John Waller, have been working to allocate people into these breakout groups. If by chance you end up in the wrong breakout room, there will be a button at the bottom of the screen that says Leave Breakout Room. You click on that and it will return you to this main room where Allison will be here to reassign you to your preferred room. So again, the rooms are 1, New England, 2, New York, New Jersey, and Philadelphia, 3, Southeast from Maryland down to Texas, 4, Midwest, including Western Pennsylvania, 5, California, 6, Pacific Northwest and Rocky Mountains, and 7th, Canada, Quebec, and international. So we're really looking forward to some productive breakout room discussions, and we remind everybody to join us for our next Saving Lives campaign meeting coming up on February 17th. Please get more involved in this campaign. I think this webinar and meeting have highlighted very clearly why we need to build this campaign and what a successful campaign can really look like if we are able to get together and unite and continue working. Thank you so much to Cesar Sanches for being my amazing co-host today. And we're now all going to get filtered into breakout rooms.